Hey guys, welcome back to my channel. So I have had my SARPE surgery and it has been about 4.5 weeks since my surgery. I had my surgery on August 5th and today is September 6th. So it has been about 4.5 weeks. So I just wanted to come on here and update you of how the surgery went, some helpful advice for people that are going to have the surgery, also how my recovery went, and then just a quick update of what is in the future for me. Alright, so when it comes to prepping for your surgery, what I would recommend is trying to eat as much as you want and the food you like best before your surgery, because it is going to be quite a while once you have your surgery before you can actually chew again. So from the time you have your surgery up until about 3 weeks or so, you're on a no-chew diet, meaning you can eat anything that doesn't require you to chew. So it doesn't mean you're only on liquids, but things like yogurt, mashed potatoes, Jello, you can have smoothies, milkshakes, anything like that. You are able to suck through a straw, so you can have milkshakes, but you're not going to be able to chew anything. There's a few reasons for that. Obviously, it's because you had major surgery in your mouth, you have stitches in your mouth, but also you can't really open your mouth that wide. After your surgery, it's going to be very tight. So I believe, I could be wrong on the time frame, but I believe it was from the time of surgery up until 3 weeks, it's a no-chew diet, and then from 3 weeks to 4 months, it's a soft food diet. So anything like spaghetti, macaroni and cheese, anything that's going to be soft and not going to require you to bite into it to chew, you can eat. Now, as for me, when it comes to that portion of eating, I have been eating spaghetti, macaroni and cheese. I can't eat ribs. I've ate hamburgers, as long as I cut it really small, and then I just basically swallow it. Or you could like mush it around in your mouth, but you're not going to be able to chew it. So don't think that, you might be like, oh wow, 4 months is a long time. It really does, it's not as bad as it seems, because you are still able to eat stuff. You just, how I put it is, you kind of just want to cut it like you are, or you would for a baby, how you cut it really small, and then you can still enjoy those foods that you like. Now, obviously, you're not going to be able to go eat a steak, so if steak is something you like, I would definitely recommend eating that, before the surgery, or, the week leading up to the surgery, because you're not going to be able to have that for quite some time. But as for the time in the hospital, I did have to stay overnight, so I'm very glad I did, because I had a really bad side effect to the anesthesia. Now, I'm going to tell you my experience, and just keep in mind this may not happen to you. It really just depends how your body reacts to anesthesia. The entire day of my surgery, once the surgery was over, I was unable to open my eyes. I could hear everything going on. I was present. So I was just really giving people hand signals and things like that, because obviously my mouth was in a ton of pain from just having surgery. But they would be like, are you okay? And I'd give them a thumbs up or thumbs down. They would ask me questions and I would answer pretty much that same way. But I did throw up 4 different times, and I threw up blood, which I guess is normal because my surgeon had already prepared me that there would be blood in my stomach. The anesthesia also gave me really bad anxiety, and it also made my heart drop really low. My heart went down to 32 at one point. So because of that, and because I also have a heart condition, which is called SVT, which usually makes my heart race, they did put me on a heart monitor overnight. But just because I experienced those things doesn't mean you will. Not everybody has the same reaction to anesthesia. But after that night, I did go home early in the morning. And the first, I would say, 2 weeks is pretty rough. So if you can, I would take 2 full weeks off of work, because the things I experienced was really bad headaches, especially in my right side of my head, like right in my eye. Just really throbbing headaches. Also, I was getting really bad stomach aches, because obviously your diet has changed, and your jaw is gonna be super tight. You're gonna feel a lot of tension in there. For me, it was hard to keep my mouth actually shut, so I kind of just had it a little bit open for a while because pulling it shut, there was just too much tension and it was hurting. So I would say the first 2 weeks are pretty rough, but after the 2 weeks, yeah, it flies by and, you know, you pretty much just go back to normal. Obviously, your diet is different, and there's a few things different. You might get occasional headaches or toothaches from turning your device. You may get stomach aches, you know, just because your diet has changed and the food that you're eating has changed. But overall, after the 2 weeks, you should be good to go. Now with turning the device. So I did start turning 1 week after surgery. I turned it twice a day. Turning isn't that bad. It does take a little bit of getting used to. It's really hard to see, at least it is for me because I have a severe overbite. You know, the lighting has to be really well. You have to put your head at a certain angle so you can at least see the hole because it's so tiny. Once you get the hang of it, it does become a lot easier. Before you know it, you'll be a pro at turning your device. For me, I did have to turn it approximately 44 times before I was finally done turning. So right now I am done turning, and this is the result. So as you can see, I do have a pretty big gap. I did go to the doctor this past Monday. Today is Friday, and they did tell me that I could stop turning the device, and they said in 8 weeks I will be getting my braces. As for a time frame, for me, I had my surgery on August 5th. I stopped turning on, I believe it was September 2nd, and then I'm getting my braces on October 28th. So, you know, not too long after you have your surgery, you might be able to get braces. I know some people have braces on the bottom and then they have their surgery, but I don't have braces yet on either the top or bottom. So I'm excited about getting my braces. So they said that they're gonna wait the 8 weeks so bone can grow where they've, you know, made the gap. So that's, I guess, why they wait that long. And then once I get my braces, we'll just see what happens from there. I'm not sure yet if I'm gonna need double jaw surgery or just bottom jaw surgery. They're gonna basically get the teeth close as they can be, and then they'll reevaluate to see what needs to be done. So some helpful advice. I would definitely recommend getting a water pick. They sell them on Amazon. I believe it's less than $25, and that really does help clean the device because it's so far back in your mouth it's hard to reach. You know, with those little toothpicks that they give you, the little bristles on the end. So I definitely would recommend a water pick, but of course be very careful because you will have stitches in the top of your mouth, that you don't put the water pick up there. Keep it strictly on your device, and then, you know, obviously you could do your lower teeth as well, but don't get it anywhere near your incision because it can open it up. Also, after you have your surgery, I definitely would recommend getting a tongue scraper. They also sell those on Amazon for about $8 for the metal ones. And the reason that this is really good to have is because you're not going to be able to open your mouth, and so sticking your tongue out to brush your tongue is almost going to be impossible. And then you're going to start getting a nasty feeling in your mouth. So at least when you have the tongue scraper, you can open your mouth wide enough to stick it in and be able to clean your tongue. Now as for the procedure, just to clarify what the SARPE surgery is. SARPE surgery is surgically assisted rapid palatal or palate expansion. So basically, I was wrong in my first video saying that they were gonna cut the roof of your mouth. I thought they were gonna cut this way, but what they actually do is they cut right here. So the reason that this surgery is performed is once you're an adult, your bones already fused together. So as a child, they can just have the palate expansion put in and their mouth will widen as needed. But because an adult's bones are fused together, that's not gonna happen. So they basically have to go in there and assist the expansion. And they make those cuts so your mouth will expand to where they need it to be. So as for the future, right now, again, I'm just gonna be waiting to get my braces on. According to the orthodontist, I will wear the braces approximately 6 to 9 months, and then after that I should be ready to have my jaw surgery. Alright, please like and subscribe the video. If you have any questions, I'd be more than happy to answer them as best as I can. Alright, thank you guys for watching, and I'll keep you posted. Bye!
Like a bird on a tree.
So, it's been the 3rd day since my surgery. This is how swollen I am. Not feeling that great. Really bad headache, especially in my eye. Hard to keep my mouth shut. I have really bad tension right here. But the doctor says I'm doing pretty good. Just don't feel that great. So hopefully over the next couple of days I'll start feeling a little better. Really not much to say. Once I'm able to talk, I'll give you more details, but right now it hurts too bad to talk. This is my gap. Alright, talk to you later.
I'm just sitting here. I got time. It's clear to see. From up here, the world seems small. We can sit together. It's so beautiful, you and me. We meant to be in the great outdoors, forever free. Sometimes you need to go and take a step back to see the truth